Today is World Cancer Day, and there is a push to educate the public about the disease, which is one of the world's deadliest. The International Union Against Cancer and its partners in some 80 countries have launched a 5-year campaign to combat cancer. Among the goals, to protect young girls from a virus that causes cervical cancer. As A Crítica TV reports from Brazil, this vaccine is still unavailable in the country's remote areas.
Maria Elizabeth is an Indian. She comes from an isolated area inside the Amazon for a medical treatment after she found out she has cervical cancer, the 42-year-old in her life.
Where I live, nobody does the test, only when something happens. Now this pap smear is helping to find many people with this problem.
Maria Elizabeth is just one of dozens of patients with cervical cancer in this hospital located in northern Brazilian city of Manaus. It's a little known fact that the virus called HPV, or human papillomavirus transmitted via sex, can also cause cervical cancer. In Manaus alone, 10% of the women who take the pap smear test are reported to have HPV.
There is an advantage. Many people are infected and don't know because there are no symptoms. So the only prevention is to use condoms.
Adult women from the interior of the Amazon and the less educated ones are the most infected with HPV in northern Brazil. Here, cervical cancer is the leading cause of death compared with other types of cancer. In this state alone, about 150 women die every year from cervical cancer, lives that could be saved with a simple test at the doctor's office. In Brazil, a vaccine has already been approved by the Health Ministry, but is not available for retailers just yet. To avoid an epidemic, public hospitals have organized preventive programs against HPV.
Here we hold regular informative lectures in our reception room. We also offer different tests, including the pap smear to those who request it.
This is Marcela Rosa from Brazil with A Crítica TV for the CNN World Report.
Young women and men are the focus of a recent cancer report in Canada. And CBC reports on the growing number of people dealing with the disease in the prime of their lives.
Are you busy right now?
A cancer diagnosis is devastating at any age, but Julie Easley was shocked when she was told she had Hodgkin's lymphoma at just 23.
It kind of reminded me when I was diagnosed of having your wings clipped when you're just learning to fly on your own.
Cancer is largely a disease of the elderly, but every year about 10,000 young Canadian adults receive a cancer diagnosis. Now they're the focus of a Canadian report that provides a comprehensive picture of cancer trends in people between 20 and 44. While the overall cancer rates for young men have declined significantly since 1992, and the rate of new cancers in young women is unchanged, there are some worrisome trends. There's been a surge in cases of thyroid cancer in young adults. It's most pronounced in women. Between 1983 and 2005, rates of thyroid cancer in young women rose by 156%. During the same period, rates of testicular cancer in young men rose by 54%. Researchers say better detection tests are picking up more cases of thyroid cancer, but testicular cancer increases are more puzzling.
We really don't know why testicular cancer rates have been increasing, and they've been increasing ever since we've been keeping statistics in Ontario going back to the late 60s.
Some who study the link between chemical exposure and cancer say environmental causes like air pollution and pesticides in the food chain must be considered.
There's a lot of things that we're exposed to, have not been assessed, and something is really not right in our population.
There isn't good research to support that. There's a lot of speculation, but the research isn't there yet.
The report also found for the first time more young women than young men are being diagnosed with and dying from lung cancer, most of it caused by smoking.
Researchers say they can learn a lot about the causes of cancer when they study young adults, and here's why. When the elderly are diagnosed with cancer, they may have 70 or 80 years of exposure to possible cancer-causing agents. It's hard to know which one was the culprit. But in younger adults, the window of exposure is narrower and the possibilities fewer. Maureen Taylor, CBC News, Toronto.
One of the ways doctors have tried to fight cancer is by using the blood taken from umbilical cords after a baby is born. We have two reports on this potentially life-saving procedure, beginning with China's SBN.
Li Jiaye is now a bundle of energy just like other children her age. But 1 year ago, failure to find the proper marrow match to treat her leukemia put her at the brink of death. Doctors finally found umbilical cord blood as another solution. After receiving the transplant, Li's health returned to normal. Doctors say every childbirth can produce up to 100 milliliters of umbilical cord blood full of young stem cells. If kept at the right temperature, those stem cells could help treat blood diseases, congenital immune impairments, and other illnesses.
Even if patients find a matching marrow donor, only 30% will end up with a successful transplant, because donors may change their minds and a patient's own body condition may change. But umbilical cord blood transplants don't have such restrictions. They also feature a high successful pairing rate and few rejections after a transplant.
Shanghai has an average of 140,000 childbirths annually. Experts say the city only needs about 5% of those giving birth to donate to reach the city's goal of 10,000 samples by 2010. Currently, the donation rate stands at only 1%. Some experts say an underdeveloped collection network could be to blame. Only 1/4 of the city's professional obstetrics and gynecology hospitals are equipped with donation centers. And doctors say it is a hassle to handle the centers.
It's a kind of duty that adds to a hospital's workload. Our staff and other resources are doing the work for free.
Experts say more funding is needed in order to make the donation centers more easily available. But in order to create a need for the centers, the public must be better educated on cord blood's benefits. They say if each hospital collects 1 donation a day, the city's 10,000 donations goal will be met in 3 months. Chen Tingjie, SBN China for CNN World Report.
5 years ago, Lolita Puga's 11-year-old son was diagnosed with an aggressive form of leukemia. She was crushed when she first heard of the disease, but she was determined to help her son survive the cancer. And he did, with the help of cells from an umbilical cord that came from Italy. It was still an experimental treatment, but Lolita took the risk. Today, she doesn't understand why this kind of treatment is considered so controversial.
My son received a transplant from a Torin boy, since one had to find umbilical cords outside the country. I would like to know if umbilical cords are just thrown away, then why can't they be used to cure our children?
Thousands of umbilical cords are preserved around the world. They contain primordial cells which can be used for transplants in patients who are not relatives, something which could offer enormous medical possibilities.
The transplant of blood from the umbilical can cure leukemia, immune deficiencies, and other diseases. Nowadays, it's known that it's possible to achieve that successfully in adult patients as well.
The risk of transplant rejection is lower in the person who donated the umbilical cord or their relatives. That's why in Spain there are many private cord blood banks where donors have priority using their own umbilical cord blood. This report was prepared by Spain's TV Galicia for CNN World Report.